Hi, this is Health Advocates Ask the Expert series, a monthly show about trending topics in healthcare. I'm your host, Courtney Preiser. Today, we welcome back Dr. Raffi Terzian, Health Advocates Senior Medical Director, to discuss strategies to help manage chronic conditions in the workplace. Welcome back.
Hi, Courtney. Thanks for having me back.
Absolutely. So we hear about chronic conditions all the time. What are some of the most prevalent that we see happening to employees in the workplace?
Sure, and this is very significant from both an employer and an employee standpoint.
Sure.
The kinds of conditions we look at are things like diabetes, hypertension, heart disease, and of course the risk factors related to those, obesity and tobacco as examples.
Absolutely. So how do these chronic conditions then impact both the individual employees but also their organizations?
Well, certainly from an absenteeism standpoint, that can have a significant impact for an employee who is managing their condition, as well as presenteeism, being present but not fully present because they're worried or concerned about making sure that their health is being taken care of. From the employer standpoint, there's an issue of productivity. An employee who's not healthy or battling a chronic condition can certainly may see a loss in productivity.
Absolutely.
So from an employer standpoint, that's very important.
That makes sense. So then what is the role of that employer in helping to manage chronic conditions among their workforce?
Sure, I think it's about creating a culture of well-being.
Okay.
And helping employees through the process, whether it be supporting lifestyle changes or giving them help with managing their chronic condition.
So really a holistic approach.
That's right, because it's all related, whether it be lifestyle or chronic condition management. It's all really a continuum of support, and I think employers can play an important part of that.
Makes sense. So what are examples then of some strategies, you touched on this a little bit, that organizations can use to help their employees managing these conditions?
Well, there are a number of things. Again, from a workplace culture standpoint, creating wellness opportunities, incentive management, tobacco cessation programs, anything that might help mitigate some of those risk factors that put people at risk for chronic conditions, and making those accessible to the employee.
And how can those then also benefit the employer?
From an employer standpoint, again, it's about trying to reduce costs related to employee productivity. So it's a win-win situation, both for the employer and the employee who can take advantage of those opportunities.
Yeah, that's great if you can make the best out of a challenging situation.
That's right.
So what makes Health Advocates' approach to chronic care management unique?
Well, we have a very robust clinical team of doctors and nurses who are able to interface with our members to help guide them through medication adherence and working through a treatment plan with their provider.
Someone to hold their hand a little bit, but to help them on that journey.
That's right. It's very much a high-touch approach, and we take a high-touch, high-tech approach. On the tech side, we give members access through a member engagement portal that offers them solutions to try to get ahead of their condition or work through lifestyle changes, as well as a app and other multi-channel communications that are available to them.
Make sure they can access the resource no matter where or when they are.
Exactly.
That's great.
The other piece of it is data analytics, really. It's taking things like biometric data, personal health profile information, and other sources of data that we can use to create targeted outreach.
That's great.
To identify folks who are at risk.
To really get personalized information, make sure they get the information that they need.
That's right.
That's
exactly.
Great. Well, this has been really helpful. Thanks so much for joining us again.
And thanks for your time.
And thank you for tuning in. If you like what you just heard, you can follow us on our social media pages below and join us again next time for another edition of Ask the Experts.